Thank you, Mr. Chairman. I have beside me Gina and Ava Szajnuk, and they'll be helping me with my presentation today. And just for the purpose of the committee, if it's okay, Mr. Chair, we actually have a substitute for this, so I want to speak to that along with an amendment that we have.
Okay, we're just getting that substitute out and around. If you want to wait a sec, or you go ahead as you're allowed, so we can see
Just
this.
so, like I said, we worked on this and we thought we were at, there was just a few minor tweaks that we had to make, so that's where the first substitute comes in. Obviously, those in the House, you all know that we've talked about councils and that. We've reduced this council down to the point where the governor doesn't appoint it, it's actually appointed by the Department of Health. And that there are no legislators on this, however, they will come back and report to the Health and Human Services Interim Committee some of their findings as they work on this. And so the folks involved in this council are truly the people who are passionate and have a desire to be part of this council. And so I think that's why this council will be effective and work well. So we made that change. We established a sunset date, which you'll see later on as we go through the session. We're going to have a bill indicating some of the sunset dates for councils and commissions, and this bill would be part of that. And so we put in a sunset date for 2025 that we have to address as a body when it gets closer to that. And then we added in there on line 2 that this is created within the department and in coordination with the University of Utah. So we've created it within the Department of Health, but we want to coordinate with the University of Utah, who is instrumental in working quite a bit on rare diseases. So this Rare Disease Advisory Council came to me by a constituent, a dear friend of mine, Jennifer Summers. I was thinking of Stan Summers, and it's not Stan. I like Stan a lot, but actually Jennifer is the real reason I'm here. Jen Summers, Stan Summers' wife, came to me and said, Lee, their son has a rare disease, and they're concerned, and they just said, we just need to have a voice. We need to be able to find out what can and can't be done, and be able to share with the legislature, along with the Department of Health, some of their concerns and some things that we can do as a state. And that's why they felt like this was a good step, is to have an advisory council to study the issues and bring this important information forward to the people who can do something about it. So with that, I committed to Jen that I would push this bill forward, and that's where we're at. So like I said, so the amendment and the substitute are really, that's what they, like I said, if there's questions, I mean, it basically says we're going to start this. There's limited number of members. We've really pared it way back. And like I said, if you look at the membership list of who would be involved in this, we're talking about the people who are truly passionate and care about this issue with rare disease that want to be on there. So it's not like some of the other things we've talked about as a body where people just don't want to be involved. This is where people truly want to be involved. And what I'd like to do is have Ava, is it Ava or Gina going to go first?
Gina.
So I'll have Gina and then Ava explain to you why this is important to them as people who have rare diseases. So.
Thank you. If you could just state your name for the record and your voice, and then proceed.
Gina Szajnuk. Good afternoon, Representative Bradshaw and everyone on the committee. As I said, my name is Gina Szajnuk. I am the co-founder of the Rare and Undiagnosed Network run. My husband, Justin Szajnuk, is here with me today as Assistant General Manager of the Utah Jazz. We have 3 children that suffer from an undiagnosed rare disease process, and I am undiagnosed as well. I was the crazy mom in 2013 that refused to leave the emergency room with my oldest daughter, Ava, sitting next to me. If we had left when they wanted us to leave, she would definitely have been blind and most likely dead. Rare disease affects 30 million Americans. Nearly 1 in 10 of your friends, family, colleagues are living with a rare disease, and half of them are children. There are approximately 7,000 different types of rare diseases and disorders, with more being discovered each and every day. 80% of rare disease are genetic in origin and thus present throughout a person's life, even if symptoms do not appear immediately, as in my case. 95% of all rare diseases do not have an approved drug treatment. There is a lot of work to be done. There are an estimated 6 million patients in the United States with a genetic disease that are not yet diagnosed. Together, this is a huge population and a huge burden on our health system. It is a public health crisis. I believe creating the Rare Disease Advocacy Council will help reduce the number of diagnostic odysseys. The RDAC will help bring together the professionals with the patients. Unification and collaboration are the key to improving the lives of families suffering with a rare disease, and it will help increase the number of diagnoses in undiagnosed rare disease community. I am standing here today in front of you, fighting for my life. I only have this one body, and I'm trying hard to find a diagnosis and a treatment for a cure for myself and my 3 precious children. And lastly, I'd like to dedicate this to someone very dear to my heart that died without knowing the root cause of his disease process only 1 week ago tonight. I was with him when he took his last breath. Please support our Rare Disease Advisory Council so we can stop losing our loved ones to rare disease and undiagnosed diseases. You may be that person someday in the near future where you may have a loved one fighting for their lives just like our family. And again, we are asking you to support the Rare Disease Advocacy Council to bring unification and collaboration within the state of Utah to help the 322,000 Utahns living with a rare disease. Thank you.
Name and then proceed.
My name is Ava Zanuck. Hi, Representative Brad Daw and everyone on the committee. My name is Ava Zanuck. I'm 11 years old and I've already been through 8 years of what we call a diagnostic odyssey. I've had 4 cranial brain surgeries and I am shunt dependent. I wish that that was the least of my worries. I also live with an undiagnosed rare autonomic neuropathy, which is what controls everything you do naturally: breathing, digestion, motility, heart rate, and temperature. I suffer in pain every single day, but I push through. As my mom said, I have a younger brother and sister who suffer in pain with an undiagnosed rare disease as well. My mother is an inspiration to me as she continues to advocate for the entire rare and undiagnosed community here in Utah and across the country. She suffers in pain more than she ever lives on. I'm here to not only speak about our family, but to stand here today to represent all of the millions of children living with a rare disease and for our rare angels watching down on us from heaven. Half of rare disease is our patients are children, and 30% of rare disease children will die before their 5th birthday. We need unification and collaboration in the state of Utah to help push forward and save the lives of the many children dying every single day to a rare or undiagnosed disease. All rare diseases were once undiagnosed. Many children and adults are born and thought to be healthy, and one day their lives change in an instant. Rare disease will touch your life at some point. It could be your mom, your dad, your friend, or even your child. Help us do all that we can in our power to let us save their lives. In closing, I would just like to say that some people ask, why do you hurt? And I say, if you knew that, I would already be cured. Imagine it like every normal person was a brilliant blue sky, and I am a raging hurricane Harvey. Thank you.
Thank you for coming today. Well, we are a terrifying group. Representative, do you have any other witnesses you'd like to have?
There's other folks in the audience I know that would like to speak to this at some point, whether you want to do it during the witness time or if you'd like to have them come up now.
Let's do it during public comment, if that's okay with you,
That's
Representative. And we will go to the committee now for clarifying questions. I assume, Representative, that concludes your presentation.
I couldn't conclude it any better than what we just heard there.
You know, for once you and I agree. Representative Miles for clarifying questions.
Thank you, Mr. Chair, and let me echo what Chair Daw said. It's wonderful to have you here, and you did a wonderful job. I think you showed up your mom.
I think she did too.
You didn't seem near as nervous, so. Having said that, I appreciate the email that you sent, and it gave some background and had a chance to look over that. I don't know, I guess my question is I think the cause is wonderful and what we're trying to accomplish to keep eyes on this, and we're under a little pressure now to look at the kind of councils and commissions, and Representative Perry can tell you that. And I guess that would be my question, Representative Perry, is it necessary to have a council like this to get to the next level? Or is it something that can be done outside of the code? Or, you know, I noticed the members that you'd like to have on there, a representative from the department, some researchers and healthcare practitioners. Sometimes these commissions and these councils, it's hard to get the professionals because they're basically volunteering their time other than a per diem and some travel expenses. I don't think you'll have a problem getting 2 representatives from the rare disease patient organizations. You probably already know those folks from RUN or Utah Rare and some of those. But having said that, Representative Perry, would you mind just addressing that issue and making me a little more comfortable with creating a new council and the bureaucracy it brings?
Certainly. And that's why, as I stated when I first talked to him, we have that, one of the amendments that we have here is to put a sunset clause in there. But because if it works and we put this council in place and it works, we may want to extend the sunset out and keep it going. But we do have a sunset in that amendment. It would dissolve in 2025 if for some reason this doesn't work. But I do believe it is important and something that we need to push forward to the council, because the rare disease community has been meeting up here. They've been up here for the last 3 years, talking with us as legislators and saying, we need you to listen to what we're talking about. But they're doing it individually.